it feels like there's a lot of possibilities here. I think what's unique about Langley is the size. It's small, but it's growing.
In a bigger site, that's kind of a difficult thing, is there's so many staff members, you really don't get to know people, but here it's small enough that you still know people in every unit that you go.
I feel like I get a good breadth of acuity, pathology, everything here, but we still have this root as sort of like a small community rural hospital.
There's a really great sense of camaraderie around people. It's kind of a place where everyone knows your name.
You get to use your voice probably a little bit more, and because you're able to do that, you can have a stronger impact on the care that you're giving your patients.
Our voices feel heard. We all work together to improve safety for our patients, and we can make changes quite quickly.
We have very much a team of people wanting to contribute and wanting to make things better.
I'm proud to be able to offer the care that I can provide in Langley.
The special part of living in Langley is the mix of the city and rural. So we kind of have the best of both worlds.
It has all the amenities of a large town, as well as being in close proximity to Vancouver and other places.
We all like shorter commute times. I'm about 8 minutes to work, so that work-life balance is super, super important to me.
It means I'm home sooner, I get to spend more times with my girls. It works great for our lifestyle.
We ourselves as healthcare professionals need to look after ourselves too. When you have that time to give back to your own family, for your own self-care activities, that also rejuvenates you.
We're really in a unique location to go north, south, east, or west to any recreation we want.
Langley's a great place to raise a family. It's a great place to kind of be and to live.
We've lived in Langley for the last 24 years. We really love this community. Everyone does look after and look out for each other.
It kind of reflects the greater community that Langley is, where people get to know each other really well, and it feels like we're serving the place that we live and the people that we see every day.
Langley Memorial Hospital is situated on the traditional unceded and ancestral territories of the Kwantlen, Katzie, and Matsqui First Nation, and also neighbors the Semiahmoo First Nation and the treaty lands of the Tsawwassen First Nation, and is also chosen home of the Wachea Métis Chartered Community. The team at Langley Memorial Hospital is committed to providing great service for all Indigenous peoples who walks through the door, and is working really hard to create a positive, supportive relationship with the local First Nations on the lands from which we're situated on.
We're bringing all of what they say, our elders, our youth, our community members, our families, and we're bringing those teachings forward and sharing them in the circle. Not only our hurt and our pain, but all of our gifts. And I think that bringing this to our circles in Fraser Health helps people come to an understanding that we need to be unified in order to do this heavy work.
It's about providing the very best care to those that are coming into the hospital to receive care, and also taking care of our work family, those that are working and providing care, so that it is that full circle of wellness for all.
I think people who work here in Langley really feel that connection to this place. Our children go to school with our patients' children. We bring our families here for their health care.
I think when you work in the same community that you live in, you're not necessarily just taking care of strangers, you're taking care of your neighbors and your friends. And so it's also just really rewarding to be able to help care for your community in that way.
I think it's a great honor to be able to provide care to people that I know.
You really feel like you're part of this bigger picture. Like, I walk to work, so it's people I can see every day out in the real world, and so I know that I'm making a direct impact into my community.
I'm so happy to be working so close to home, and I do feel strongly about improving healthcare in my local community.
I've lived here for over 20 years. I've raised my family here. This is my hospital, this is my home, and that's really what makes us committed to and proud of the systems of care that we constantly innovate and change and grow to meet the needs of our patients.
The foundation is really invaluable. We can't do the work that we do without them. They've helped us procure equipment, they've helped us renovate spaces, they've helped us secure funding for education for our staff, and we really are so appreciative for that partnership.
It's a feeling. I really feel like the team wants to make a difference in the lives of patients, and so that they're ready to pull together and do whatever it takes to do what the patients need. So that's really what keeps me here.
I think there's good care everywhere, but there's extraordinary care here.